Removing patient from vehicle. Attach sling, seated position. 1. It is often helpful for a caregiver to be positioned on both the passenger and driver's sides of the vehicle to assist in positioning the sling and to aid in transferring. Prior to applying the sling, loosen all straps as needed to accommodate the girth of the patient. If the patient is in a back seat, slide the front seats to their forwardmost positions in order to provide additional workspace. Note, it is helpful to recline the patient's seat, if possible, prior to lifting. Also, the shoulder straps should be slightly slack so that the patient will be in a more reclined position when exiting the vehicle. This will allow the patient's head to more easily clear the door frame of the vehicle. 2. Lean the patient forward and position the padded sling behind the patient with the pocket side facing the seat and the padded portion facing the patient. Position the sling so the center waist belt is aligned with the patient's hips or is as close to the hip region as possible. 3. Position center post of leg harness below the navel of the patient. Slide both buckles located on the waist belt straps over the post. Tighten the straps to a snug fit. The post should be positioned below the patient's navel. 4. To affix the leg straps, lift the patient's leg and pull the leg strap affixed to the center post under their leg. Wrap the strap around the outside of the uppermost part of the thigh. Thread each strap through the respective ring at the side of the padded sling, and slide the buckle over the post. Repeat with the other leg strap. Be sure the leg straps are secured in the upper thigh area and not in the knee area, and there is not any slack in the straps secured around the patient's legs. 5. Drape the shoulder straps over the patient's shoulders. Attach sling lying down. When attaching the sling to a patient that is lying down, lean the patient on his or her side and follow the same procedure as when attaching the sling to a seated patient. Note, if you are having difficulty positioning the sling under the patient, position the leg harness on the patient, hook the clip on the end of the cable to the leg harness post, and raise the cable a few inches to elevate the body. This will allow you to slide the sling under the patient more easily. Once the sling is properly positioned under the patient, lower the patient to the vehicle seat, unclip the cable, slide the waist buckles over the post, and proceed as directed. Position lift. Note, easy out must be positioned carefully so as not to damage vehicle and be carefully maneuvered to avoid direct contact with the patient. 1. Adjust the boom height to accommodate the height of the vehicle using the up and down arrow buttons on the hand control. It is beneficial to position the boom in the lowest position possible prior to lifting the patient. 2. Adjust the position of the mast on the lift track from side to side to accommodate differing wheel well configurations and car door clearances by squeezing the locking pin handle located on the mast directly in front of you as you are standing behind the lift. The mast can be adjusted 12 inches either direction from the center of the lift. Simply squeeze the handle, slide the lift on the trolley either direction, and make sure the locking pin locks into place in the holes located on the base. Note, it is best to keep the position of the mast on the base in a stationary position when a patient is in the lift. However, certain configurations and situations may dictate the slight adjustment of the mast on the base from side to side in order to better align patient for extraction through the vehicle door frame. In the event of the need to adjust the position of the mast, 2 caregivers should be utilized when a patient is attached. Note, when adjusting the position of the mast on the base while a patient is in the lift, a patient must be positioned over a supporting surface, such as a car seat. 3. Adjust the lift handles as needed from the up to the down position. Lift the handle slightly with one hand and push up on the bottom of the locking clip located next to the mast. This will allow the handle to lower. Do not insert your fingers in the locking clip opening. To raise the lift handles, lift the handle and the locking clip will lower and secure the position of the handle. Attach sling to lift. 1. Position the boom inside the vehicle so the end of the boom is positioned over the sling post attachment point. 2. Lower the boom as far as possible. 3. Hook the metal clips of the shoulder straps onto the end of the boom and tighten straps as necessary. 4. Lower the lift cable using the down arrow button so that it is low enough to clip to the center post of the sling. 5. Clip the cable to the hole in the center of the post. The end of the lift boom should be positioned over the patient's waist area. 6. Tighten shoulder straps as necessary. Make sure that the waist and leg buckles have been inserted through the rings on the sides of the sling and over the post. The cable clip is securely fastened to the center post, and the shoulder strap clips are secured around the boom end notch. Do not allow the patient to hold on to the cable. Raise patient. 1. Using the up button on the hand control, raise the boom so that it will just clear the door frame. Then, use the cable to raise the patient high enough so that they can be extracted from the vehicle. Raising patient from seated position. Raise patient to the point where the hips and thigh regions are no longer in contact with the car seat. If patient is located in a front seat, it may be helpful to recline the seat once all straps, including shoulder straps, are attached to the easy out. Carefully rotate patient until their body is parallel with the easy out. Raising patient from supine position. Raise patient to the point where the hips, shoulders, and torso are no longer in contact with the car seat. If needed, rotate the patient until their body is parallel with the easy out. 2. When raising the lift boom, be sure the boom does not come in contact with the car frame or interior ceiling. Prior to extracting the patient from the vehicle, pay close attention to the height of the patient's head and verify that their head is low enough to clear the height of the door frame when extracting. 3. Adjust the patient's legs so they are clear from obstructions when wheeling the lift away from the vehicle. Transfer patient to wheelchair or stretcher. 1. Be aware of any cracks, obstructions, or uneven surfaces when maneuvering the lift. Wheel the lift backwards away from the vehicle. Immediately position a stretcher or wheelchair under the patient. 2. Use the hand control to lower the patient onto the stretcher or wheelchair by lowering the boom and/or cable. 3. Unclip the clip from the center post, remove the shoulder strap clips from the boom notch, and slide the buckles off the center post of the sling.